Urodynamics study procedures and benefits for neurogenic bladders. A urodynamic study is a series of tests that assess how well the bladder and urethra are storing and releasing urine. This study is particularly beneficial for individuals with neurogenic bladders, a condition where the normal nerve functions that control the bladder are disrupted, often due to spinal cord injuries or neurological disorders. The procedure for a urodynamic study is typically conducted in a specialized clinic or hospital. Before the test, the patient is advised to arrive with a comfortably full bladder. The procedure often includes the following steps. First, the patient is asked to urinate into a special toilet or funnel to measure the urine flow rate and volume. This test helps assess how the bladder empties and detects any obstruction in the urine flow. Afterward, a thin catheter is gently inserted into the bladder through the urethra. This catheter measures the volume of urine remaining in the bladder after voiding, known as post-void residual urine volume. Another catheter is placed in the rectum or vagina to measure pressure in the abdomen, and sensors on the skin measure bladder contractions. The bladder is then filled with sterile water or saline to measure how it stores urine and at what pressure. The patient is asked to communicate any sensations experienced, such as urgency or discomfort. The last part of the study involves recording bladder contractions and pressures while the patient attempts to urinate. This step evaluates how effectively the bladder muscles contract to expel urine. For those with neurogenic bladders, the information gathered from a urodynamic study is invaluable. It helps medical professionals understand the specific dysfunctions within the bladder's storage and release mechanisms. Understanding these dynamics allows healthcare providers to tailor treatment plans precisely, improving quality of life. Benefits of this study include identifying the need for interventions like medications that manage bladder contractions, surgeries for correcting anatomical abnormalities, or the potential use of catheters for regular emptying. Additionally, it guides therapists and patients in developing bladder training programs. In conclusion, a urodynamic study is a significant procedure for managing neurogenic bladders. It provides essential insights that lead to better management and treatment, ensuring patients can lead more comfortable and controlled lives.